Hi, today I'm going to talk about a healthcare subject, and this is really mainly for the United States. It's not for anywhere else because y'all don't have to deal with this. But this is something we have to deal with here. These days, I am more of a patient than I am a healthcare finance consultant because I can't really travel because my mother now lives with me and I'm the caregiver for her. However, most of what I do, I can actually do at home, but hospitals for some reason think I need to be sitting in their office by myself, mind you, doing this work and then going out to talk to their people. I don't have to do it that way, but a lot of them think I do. So I spend a lot more time these days as a patient or going to appointments with my mother. Now, Mom is covered because my mother's got 3 different types of insurance. She's totally covered, no issues for her. But my insurance is different. Because I'm self-employed, I buy insurance through the New York State Exchange. And because insurance is still expensive, I basically have most of my stuff allowance. That's the terminology that they use. In essence, what happens is I go in for a service, it gets billed to my insurance company. Because I have a high deductible, they don't pay anything, but the provider, whether it's physician provider or a hospital, and I ain't been to a hospital since I was born, so it's not really the hospital, but whoever it is that I go to has to adjust the bill down to the amount that the insurance company said they would have paid, and then I actually have to pay what's left. So, one of the things that I do from time to time when I'm doing something that's out of the norm is I want to know how much I'm going to have to pay before I have a service done. So next week I go and I'm going to see an ophthalmologist. Not an optometrist, an ophthalmologist. Because I'm diabetic, I've had issues with my eyes over the years. Matter of fact, it was because of my eyes that I found out I was diabetic. I mentioned that in an earlier video in this series. So I need to know how much I'm going to pay. Not because of the office visit. That's not really a big deal. It's because I was informed that it's been 2 or 3 years since I had these other 3 tests done on my eyes. Now, here's the deal. I get caught off guard just like everybody else. Only once. So when I had this done before, I never really thought much about cost. I'm sitting there in the office. They wanted to do this test. Sure, let's go. Let's do this test. And I get a bill for $1,400. I said, whoa. So the last time I went to the doctor, I said, wait, Doc, I'm not getting hit with a big bill. So pick one thing here that you think really needs to be done. And that's the only one we're doing. So that's what we did because this is something I understand. Well, this time around, they say there's 3 tests they want to do. I want to know how much it's going to cost. So the first thing I do is I call the business office for the doctor's office, not the financial, but the people who book everything. And I say, okay, I need to know what services you guys want to do on me and how much they're going to cost. And the lady says, well, I can tell you the names of the services, what we call it, but I don't know how much they are. I say, okay, if you do that for me, can you tell me what the CPT code is? Now that means current procedural technology or terminology, version 4, CPT, or procedure codes. And she said, oh, I don't know any of that. You have to get that from the billing office. I'm already thinking, no, I'm not. Why? Because they're not going to have it. I know they're not going to have it. They should, but they're not going to have it. They're going to put it off on someone else. Still, I ask her to tell me, okay, tell me the services. So she tells me the services, and I call the billing people. And the first person I get tells me exactly what I thought she was going to say. Oh, but I don't know. We don't know any of those prices. You have to get it from the business office, to which I said, no, I already talked to them. They sent me to you. Says, well, we don't know how to do that. I mean, we don't have that. I said, okay, let me tell you something. I've been a consultant for 19 years. I've been in healthcare finance for 35. We live in New York State. You have to tell me what the prices are for the services I'm going to have. Now she's stunned. She doesn't say anything. Oh, let me see if I can find some information. So she goes away for a couple of minutes. She comes back and she says, well, they said we don't have that information. Give me a supervisor. Give me someone in charge. So now she gives me someone in charge. And I say to her, after I've said this thing and she said her thing, I said, okay, you don't have an understanding of this. Let me explain how this works. You have to tell me the prices for what I'm having done. Now, I understand that one of the procedures can be done 3 different ways, which may change the price, but you have to tell me this. We're in New York State. What I didn't tell her is that it's also a federal law. It's called price transparency. You have to tell me this. And they, even though they're physicians, they work for a state organization, so they have to give this to me. So she says, oh, well, let me see what I can do. So she goes off to see what she can do. And I hear back from her about 3 or 4 hours later. She says, well, I have some things for you, but I don't have everything. So she proceeds to tell me the first 2, and she gives me the procedure codes because I asked for them. And then she tells me what the price is for those 2. Then she said, and when I was talking to them, they said they weren't really sure about the 3rd test. It could be done different ways, and the price kind of fluctuates, and they wouldn't know that until they did the exam. I said, well, okay, just give me one of them, so at least I have some kind of idea of what we're talking about. And she gives me an idea, and that's that. So at least now I've got something. And now this is their general price. And I'm looking at the price of these particular tests that they're going to do, and I said, well, you know what? I know that based on history, I'm going to have to pay probably at least 75% of each one of these. Now, I could have gone further, which is to call Blue Cross, because that's who my insurance is through, and ask them how much they would normally pay on this and what my liability is going to be. But I established a protocol, which is that you have to tell patients how much something is, or at least you have to estimate. And because a lot of people don't do this, most people, including me that one time, gripe when we get a hospital bill and say, oh my God, what was this? What did they do? Whatever. Whereas, unless you're in an emergency room, you have the right to ask them, hey, about how much is this going to cost? Because they can't give you definitives. For instance, if you're going to go in for a surgery, unless it's like a plastic surgery, which is a totally different animal, but if you're going in a hospital for a surgery, what happens is that if they're doing it right, you have an hourly rate, which is for the first hour, and then they will bill you subsequently either every other hour or every other half hour. And that amount will be a little bit less. And the thing is, physicians are kind of weird in the fact that you can get 5 physicians doing the exact same operation, but they're not all doing it the same way, and they don't all do it at the same rate, you know, as far as speed. So one physician may be in there and get you in there in a half hour. Another one could take up to 2 hours. And then for some procedures, like a pacemaker, for instance, if you need, like they come with a pacemaker that they think is going to work, and it turns out, oh my God, that one doesn't work at all. We need to upgrade to another one. Well, now you've got a more expensive pacemaker, most probably, and now it's going to take longer because it's a little more intricate and there's more things they have to do. So for stuff like that, it's a little dicey, but at least you get a range. But if you're going in for an X-ray, for instance, or an EKG or EEG or whatever, they have to tell you if you think to call. And you might have to be bounced around a little bit, but they have to tell you what the price is of stuff. They can't tell you how much they're going to pay. That's how come you need to ask for a procedure code, so then you can call your insurance company to find out. So in my particular instance, it's probably going to come around $800 or so, but it's way less than that $1,400 I got hit with 3 years ago. So I can live with it. That sounds weird, doesn't it? I can live with an $800 bill. Hey, you know what? I've got to watch my eyes. I need them watching my eyes. They've actually been improving over the last couple of years as I've gotten control of my weight and my diabetes and whatever. So that's actually good. But they need to test because I'm right on the border of possible glaucoma. I hope what I've done over the last year will make that better, but we shall see. There you go. If you have questions about this type of thing, y'all let me know, because like I said, this isn't something that you can just ask almost anybody about, because most people don't know this information. And I'm always glad to help. My name is Mitch Mitchell. If you like stuff like this video. If you don't, dislike the video, but just tell me why you don't like it. And if you like it, think about subscribing and think about clicking that bell for notifications. Yes, I'm doing this thing with my hands. My name is Mitch Mitchell. I hope y'all have a wonderful day.